Hi, my name is Vanessa Lack. And so tonight is a late night impromptu once again video slash podcast that I'm doing about a news article that came out. I think it was, yeah, in the last couple of days it came out. Basically, it was about Veterans Day, and it was about some protests from veterans outside of the U.S. Department of Veterans Affairs as it pertains to Veterans Health Administration, a topic which, if you're following me at all, know for sure that's something I talk a lot about, and for good reason. And unfortunately, Veterans Health Administration has played a very daunting role in my life in trying to control me and my life, and it's been very daunting in a lot of different ways. And tonight, I'm going to talk more about that and show you a really important news article that I stumbled upon just now that I want to share with everyone in America, because everyone in America needs to know about this so that legislation can change and veterans can have some choices. Okay. So before I get started, I just want to say that, you can find this podcast slash video basically everywhere on Rumble. had this screen up just a minute ago, YouTube, LinkedIn, hellovanessamedia.com, and also on all podcasting platforms. There's a link as well if you want to support this content, anchor.fm /hellovanessamedia /support, anchor.fm. Their company basically it's like host it, and you can do like a subscription to support as you choose to. I also plan on rolling out a product line soon related to what I talk about. I've got some different ideas going on. It's going to take some time. It's not going to be right away, though. I think it's probably going to take months to get going. So that's something I'll share when I have it ready. In the meantime, I do have a website, hellovanessamedia.com, and this is a link where you can go, anchor.fm /hellovanessamedia /support to support the work that I'm trying to do here. Okay, so I'm going to get right to it. Add this, show you guys this article. I actually have read it extensively already, and I have some highlights that I want to share. So Veterans protest outside VA for better care, written by Mike Brest, Washington Examiner. It's dated November 10th, 2021. And so I'm guessing it must have been right before Veterans Day that this took place. Now, I'm going to go ahead and start rolling straight to some of the highlights. And let's see. Okay, so you should be able to see exactly what I'm talking about here. But basically, some of the highlights include, but are not limited to, hold on, I'm trying to look at my notes here at the same time when I talk. Okay, I got my notes pulled up here. All right, so some of the highlights from the article are, and these are direct quotes, a department that is more focused on bureaucracy than on helping the veterans who depend on its care. Okay, that can be seen here in where I'm at right now with this article. So check that out. And so that is 100% true. Veterans Health Administration is absolutely more focused on protecting its bureaucracy than on helping the veterans who depend on its care, which is actually supposed to be the mission of Veterans Health Administration. The mission is supposed to be helping veterans who depend on it for healthcare. That's not what's happening here. This I know for sure. I do only speak for myself, but after working at the organization, after being a patient and getting my services via the organization to this very day, I know this is not true. Okay. So it is a bureaucracy that is focused more on itself and helping itself than it is on helping veterans. This I know for sure. I'm not saying that everyone that works there is like that. That's not true. There's great people who work there, but for sure, it really is more focused on serving itself. Okay. It's just a sad reality of what's going on here. And after working for the organization, having my civil rights violated many years ago, and dealing with whistleblower retaliation or reported legitimate issues, I know that bureaucracy protects bureaucracy at the end of the day. That's what's going on here. So even the oversight agencies like the Equal Employment Opportunity Commission, it's just more bureaucracy protecting bureaucracy, wasting tax money. That's what that is. Okay, the next highlight I want to point out is another quote. The bureaucracy seems to be more important than the veteran, and that if the bureaucracy is experiencing a drop off, or letdown in folks using them directly. I think their impetus, first and foremost, is to make sure that the veteran is coming to their facilities. 100,000% agree with that quote, that statement from the news article as well. So I have an email from one of the staff at the Alexandria, Louisiana Veterans Affairs Medical Center that states that they basically, I'm paraphrasing here because I don't have the email in front of me, but basically states that their people that work there are really focused on requiring veterans to go there for services, even if they don't want to, if they're offered there at that facility. And they're doing that so they can keep getting paid. That's what's going on here. It's about building more facilities. It's about keeping people paid. That's what it's about. The veterans healthcare is actually the last thing that is a concern for them. And also, they're really focused, Veterans Health Administration, on monopolizing veterans healthcare. That's what's happening here. And they want to keep this very socialized. So when I hear politicians say, which I've heard, one in particular, which I'm not going to name so I don't give them free advertising, that, well, veterans health administration is going so well, we should implement this for the rest of the nation. If you implement the Veterans Health Administration system setup for the rest of the nation, people are going to start dying from medical malpractice and other systemic failures that are happening inside of Veterans Health Administration. Veterans Health Administration is imploding, okay? That's what I see. I see it here locally. Excuse me. I see it here locally happening at the Alexandria, Louisiana Veterans Affairs region, okay? That the Veterans Health Administration is imploding. That's what I see. And I believe it's really throughout the country, even though I understand there are great people who work there. I understand that everyone has different experiences there. But after having worked for the organization for 2 different facilities in 2 different regions for 2 different years and being a patient of the facility to this very day right now, there's no doubt in my mind that the Veterans Health Administration is absolutely failing systemically. And as a result, veterans are dying. That's the truth of what's happening here. These people don't need to be given more control over preventing and sabotaging veterans from having a choice about where they get their health care. They don't need to be given more money to just do God only knows what with and make up their own numbers and be unaccountable. They need to be empowering veterans to have a choice about where they receive their health care, when they receive their health care, and who provides their health care. Veterans, just like everyone else in America, all of these patients have a right to informed consent, to be able to accept or to refuse medical care. And right now, like that, my experience, that's not happening in Veterans Health Administration. Okay. Next highlight. Better enforcement of the Mission Act legislation that was passed in 2018 that ensures veterans have quality medical care after leaving the military at the VA or at another healthcare facility. So this is something else I agree with, and I 100% have noticed is occurring. The reality is that the laws that have been enacted to protect veterans in the military community and even employees that work there from, like civil rights violations, whistleblower retaliation, are not being enforced. I know as a fact right now, these laws are supposed to be protecting veterans are not protecting veterans in the way that they were intended. I know this because I'm a patient there. This is my direct experience as recent as of today. Okay. Well, I guess yesterday, because it's midnight where I'm at, but they ignore the laws, has been my experience of the Veterans Health Administration, to keep a captive audience at their facilities, to keep people employed, to keep monopolizing veterans healthcare. It's not about the healthcare, it's about keeping the money. That's what they want. Okay, that's what's going on here. So we need to have new legislation to protect veterans and people eligible for these services, and we need to disempower the people that continue to power trip on veterans, and we need to enforce these laws. Okay, that should be an option for every veteran, right? The freedom to choose where they receive their care. That's another quote. So basically, I'm taking all these quotes out of context because they're out the news article. They're basically the highlights that I see. And I want to, and it's right here, that quote right there. I wanted to kind of just hit the highlights, not reading the whole article. So basically, I agree, veterans should have the right to choose where they get their healthcare. And currently, the way the system is, that's really not the case. The emphasis is not on choice. In fact, quite the opposite. The emphasis is on, once again, socialized healthcare system, monopolizing veterans' healthcare, getting as much money out of American taxpayers as possible and into the pockets of, the people that have the most, stand to gain the most, basically, inside of a very broken healthcare system, which has been broken, by the way, for generations, is something I like to point out. There was a movie, Runkovic, 4th of July, Born on the 4th of July, based upon a book written by a Vietnam veteran. And that depicted some very harrowing experiences from that person when they were at a veterans health facility. Of course, they've come a long way, these veterans health care facilities. I'm not denying that at all, but the problems could still continue to be riddled throughout Veterans Health Administration. They continue to be systemic. And I have found, as a patient at Veterans Health Administration, that there is a very oppressive attitude going on, at least here in Louisiana, about disempowering veterans from being able to choose where they get their health care. I mean, I have an email in my inbox sitting right now from Veterans Healthcare today, their staff, trying to deny me of health care because they don't want me leaving their facility. They're trying to force me to stay at their facility, even though I've expressed time and again, I don't want the VHA involved in my medical decisions or touching me. That's what I told them repeatedly in writing, and still I'm dealing with this. So this is not just me. Next thing I want to point out, highlight, quote from this article. VA administrators have been overruling doctors' judgments and have been preventing them from sending their patients to outside facilities, according to an investigation from News Source. Not familiar with that. In partnership with USA Today, I have heard of that newspaper. Released earlier this month, and they came to their conclusions after reviewing thousands of pages of department manuals and medical records, along with interviews with dozens of patients, advocates, and providers. So this is news to me. I actually was unaware of these findings being so widespread, but this has been my direct experience as well, which has been very recent as this year, and it's been very challenging to deal with. It's been a constant source of conflict, and really, quite frankly, high conflict, fighting, and disagreements. And I know that because of the way that I'm being treated, that I'm viewed as a dollar sign to get into these people's pockets, wallets, and not as a human with human rights and healthcare rights and legal rights. Okay, next highlight. I am increasingly alarmed by the concerns I hear from veterans and from stories like this one. Representative Mike Bost, the ranking member of the House Committee on Veterans Affairs, said regarding the investigation. According to CBS 8, they all point to one thing: VA not following the law and holding veterans hostage to a healthcare system that is not serving them. Okay, so I have the entire link to this article, this news article, in the description below, as well as every single highlight that I just covered. So if you would like to see more about that, feel free to check that out. Oh, you're welcome. Thank you for the support, recognition. Really do appreciate that. So thank you. So that is what I wanted to cover this evening. I mean, I had told myself I was not going to do another video, podcast, whatever, until next year sometime because of my other obligations I have going on. However, unfortunately, when it comes to the Veterans Health Administration at this point, it is just something I feel like I cannot avoid putting out there in the public sphere, because I just feel it's really important, in that I've tried other methods over the last nearly 10 years of dealing with this organization to affect change, and I have failed on a lot of different levels to affect the kind of systemic change that I want to see in the organization. Now, the Veterans Benefits Administration, I keep mentioning them, in the cemetery division, they are much more functional, in my humble opinion, although some would disagree, and I respect those disagreements, than Veterans Health Administration in my direct experience and research. And I don't really know what is going on or why Veterans Health Administration is so dysfunctional, but it is really dysfunctional, and it seems to be well known by anyone that knows a whole lot of anything, like in the healthcare circles and whatnot. I have been in healthcare for most of my adult life in some way, shape, or form, and so I have above average knowledge about general information pertaining to the law and healthcare because it's required by my work. information regarding what the requirements are for healthcare providers in general because of my work historically. And so I'm able to pick up on a lot of information inside these facilities that a lot of people would not be able to pick up on. And then I used to work at Veterans Health Administration in a medical capacity for 2 different years at 2 different facilities, not in Louisiana, but in completely different states, 2 different states. So there's a lot of knowledge that I have about this organization, and then also being a patient, and then also being involved in the military community as well, that I've learned and picked up on. So whatever the case, I have a moral obligation here to spread this information and affect change. And I do believe change is coming. There have been new laws like the, I believe it's choice law. I'm probably screwing that up, and the Mission, I think, Act, and then Deborah Sampson Act, I believe that's another one. If I'm not messing it up, these names, they've all been introduced in the last number of years. So, more change can come, but the pressure has to stay on because there's a lot of people with a lot of financial incentive basically to stop change from coming so they can financially profit. And there are many providers, I was one of them, that don't make much money at Veterans Health Administration. They're actually severely underpaid. And then there's certain managers that are making obscene amounts of money and bonus money too. So it's a bad situation. It's a real mixed bag. So anyways, I'm going to continue to do these videos and podcasts as I see fit and as I'm able to do so. And I've got a new light and microphone coming in the mail next week. Hopefully that will work and help me with these impromptu videos and making them a little bit better quality impromptu. All right. I wish you all the best. And don't forget, you can find the videos/podcast on Rumble, YouTube, all the podcasting platforms, LinkedIn, and there's also a website, hellovanessamedia.com. So more coming soon. Thank you. Good night.